I remember the exact moment I realized my balance wasn't what it used to be. There were no obstacles, no distractions, just a quiet morning in my kitchen, and suddenly I tripped. I didn't fall, thank goodness, but something inside me shifted. A quiet voice whispered, "What if I hadn't caught myself? What if I had fallen?" That moment stayed with me because losing balance isn't just about tripping or being clumsy. It's about something deeper: our confidence, our independence, and most of all, our safety. If you're a woman in your 60s, or like me, in your 70s, you need to hear this. Doctors now say that 99% of older women will struggle with balance at some point. That number shocked me, 99 out of 100. But here's the part that gave me hope. Most of those balance problems aren't just about getting older. They're caused by small, everyday mistakes we make, things we can fix, starting today. In this video, I'm going to walk you through 8 common mistakes that could be stealing your balance, your confidence, and even your freedom without you even realizing it. And mistake number 6, that one made me fall hard. But it also taught me a lesson I'll never forget. You're not alone in this, and you're not powerless. There are simple steps you can take, starting right now, to feel stronger, more stable, and safer. Before we dive in, don't forget to like, share, and subscribe to Elderly Health Tips, because staying upright starts with staying informed. Right now, stay with me as we explore 8 common mistakes that cause balance problems in older adults. The first mistake we need to pay attention to: wearing the wrong shoes. Your shoes might look harmless, but what you wear on your feet could be the silent reason you lose your balance, break a bone, or even lose your independence. According to the Centers for Disease Control and Prevention, CDC, 36 million older adults fall each year in the US. Of those, over 32,000 die from their injuries, and 3 million end up in emergency rooms, many with hip fractures, head injuries, or worse. And here's the part most people don't know. One of the most preventable causes: improper footwear. A landmark study published in the Journal of the American Geriatric Society looked at over 10,000 falls among seniors and found that 27% were related to shoes either being barefoot, wearing socks, or using footwear with no support or grip. That's nearly 3 out of every 10 falls that could have been avoided by changing what's on your feet. And it's not just about slipping. Poor footwear can change how your brain and body communicate. As we age, proprioception, our body's ability to sense, position, and movement, declines. If your shoes are too soft, or the sole's too thin or smooth, your brain gets less feedback from your feet. That means slower reflexes, weaker balance, and greater risk with every step. Dr. Carol Frey, an orthopedic surgeon and sports medicine expert in California, once said in a UCLA symposium, "Supportive footwear is as essential to seniors as a cane or walker might be, but no one wants to talk about shoes until they're recovering from a fall." Let me tell you about another patient, George, 68, retired fireman. Strong guy, still chops his own firewood. But last winter, he fell in the driveway wearing worn-out sneakers he bought 8 years ago. The treads were smooth, the heel was crushed in, and the padding was long gone. He fractured his wrist and ended up needing 4 months of physical therapy, all because of a shoe he didn't think twice about. So what does safe footwear look like? The National Institute on Aging and NIH recommend the following features for seniors' shoes: rubber soles with strong tread, low, wide heels, nothing over 1 inch, firm heel counters to prevent side wobble, cushioned insoles, ideally with memory foam, adjustable fasteners. Velcro is great for a snug, secure fit. Mistake number 2 we should be more careful about as we age: ignoring our vision health. If you can't see the danger, how can you avoid it? Poor vision is one of the most overlooked reasons older adults fall, and it's entirely preventable. Let me paint you a picture. You're walking into the kitchen at night, the lights are off, your eyes take longer to adjust, you misjudge the edge of a mat, and boom, that's a broken wrist or worse. I've seen this happen again and again. Not because someone was careless, but because they couldn't see clearly enough to stay safe. One of my patients, Dorothy, 77, fell on her front porch last Thanksgiving. She said the step came out of nowhere. Turns out she had untreated cataracts and hadn't had her glasses checked in 6 years. Her eyes were struggling to pick up contrast between the gray step and the sidewalk. This story is more common than most people think. According to the Centers for Disease Control and Prevention, CDC, every year 3 million older adults are treated in ERs for fall-related injuries. Vision problems are a major risk factor for these falls, but often go undiagnosed or untreated. The National Institutes of Health, NIH, adds that by age 75, more than 50% of adults will have cataracts, many of them untreated. Nearly 1 in 3 adults over 65 experiences some form of visual impairment, often without realizing how it affects their depth, perception, or balance. A major study published in JAMA Ophthalmology followed 1,508 seniors over 4 years. They found that those with visual impairment were 2.4 times more likely to fall and 3.6 times more likely to suffer a serious injury. That's not just a coincidence. Vision plays a critical role in spatial awareness, depth perception, edge detection, and contrast sensitivity, all of which are essential for walking safely. As we get older, the pupil shrinks and lets in less light, making it harder to see in dim conditions. The lens becomes less flexible, affecting focus at different distances. Peripheral vision narrows, meaning you miss things at the edge of your sight. Contrast sensitivity drops, so steps, curbs, and shadows become harder to detect. And yet many people chalk this up to just aging and ignore the warning signs. So what can you do about it? Get a comprehensive eye exam every 12 months. This means dilation, pressure testing, and checking for conditions like cataracts, macular degeneration, and glaucoma, not just reading the chart. Update your glasses every 1-2 years. Don't wait until you're bumping into things. If you feel your vision is just a little off, that's your cue. Increase lighting in every room, especially near stairs, bathrooms, kitchen corners, outdoor pathways. Use motion sensor lights and night lights. They're inexpensive and they work. Avoid glare. Choose soft white LED bulbs and use matte surfaces whenever possible to reduce sharp reflections that confuse the eye. Consider task-specific lenses. For reading, driving, and screen time, the right lens design reduces eye strain and improves contrast. Red flags to watch for. You might not know your vision is causing balance problems. Look out for frequently misjudging doorways or steps, reaching for handrails just in case, avoiding going out at night, headaches or eye strain in low light, feeling off balance in new environments. If you're experiencing any of these, don't wait for a fall to happen. Mistake number 3 that we often make as we get older: skipping strength training. After the age of 30, we all begin to lose muscle mass naturally, but after 50, the decline speeds up significantly. According to the National Institutes of Health, NIH, adults lose an average of 1-2% of muscle mass per year after 50 if they don't engage in strength-building activities. By age 70, most people have lost 20-30% of their muscle strength, especially in the lower body. The Centers for Disease Control and Prevention, CDC, has linked this loss directly to increased falls, higher rates of disability, greater dependence on caregivers, longer hospital stays after injury. And the scariest part? You don't notice it until it's already become a problem. A 2016 study in preventive medicine analyzed data from over 30,000 adults and found that older adults who engaged in muscle strengthening exercises at least twice a week had a 46% lower risk of early death from all causes. Another study in JAMA Internal Medicine confirmed that grip strength and leg strength were among the strongest predictors of long-term health outcomes in seniors, even more than blood pressure or cholesterol levels. And according to Harvard Medical School, maintaining muscle mass helps prevent type 2 diabetes, osteoporosis, arthritis, cognitive decline, depression. So no, lifting light weights or doing squats in your kitchen isn't just about fitness. It's about staying alive, staying mobile, and staying you. Let me tell you about Marie, one of my favorite patients. She's 73, lives alone, bakes the best banana bread in the state. But a few months ago, she told me she avoids walking to the store now, not because of pain, but because my legs get shaky halfway there. She hadn't done a single strength exercise in over a decade. After just 8 weeks of simple at-home training using soup cans, a chair, and her own body weight, she was walking confidently again. She didn't need a gym, she needed a plan. You don't need fancy machines or heavy lifting to see results. You just need consistency and a few smart moves. Here's what I recommend to all my patients over 50. Start small, 10, 15 minutes, 2-3 times a week. Examples: wall push-ups, great for upper body and chest. Seated knee extensions, strengthen quads and improve balance. Chair stands builds leg and core strength for daily tasks. Light dumbbell curls helps with grip, shoulder stability, and blood flow. Heel to toe walking, simple but powerful for stability. NIH guidelines say older adults should aim for at least 2 days a week of muscle strengthening activities targeting all major muscle groups. Even resistance bands or gallon water jugs can be your weights. You're not training for a marathon, you're training for independence. Not sure if this applies to you? Watch for these subtle red flags. You need your hands to stand from a chair. Climbing stairs feels harder than it used to. You've started walking slower without realizing it. Your arms feel weak when lifting groceries or doing laundry. You feel off balance more often, even on flat ground. If you say yes to even one that's your wake-up call, mistake number 4 is very dangerous: not paying attention to medication side effects. According to the Centers for Disease Control and Prevention, CDC, every year, over 3 million older adults in the U.S. are treated in emergency departments for fall-related injuries. Among those, 1 in 3 falls is linked to side effects from medication, especially those that affect blood pressure, brain function, or balance. A 2021 report from the National Institutes of Health, NIH, found that over 85% of adults age 65 and older take at least 1 prescription medication daily. Around 42% take 5 or more medications, a situation known as polypharmacy, which increases the risk of dangerous drug interactions. According to a study published in JAMA Internal Medicine, seniors who take 4 or more medications are nearly twice as likely to experience dizziness and loss of coordination compared to those taking fewer meds. The most common balance-disrupting drugs include antihypertensives, for example, lisinopril, amlodipine, can cause sudden blood pressure drops. Sedatives and sleep aids, for example, zolpidem, diphenhydramine, Benadryl, increase drowsiness and reaction time. Benzodiazepines, for example, lorazepam, diazepam, impair coordination and reflexes. Pain relievers, for example, tramadol, opioids, cause dizziness, blurred vision. Antidepressants, SSRIs, tricyclics, interfere with balance, especially when standing up quickly. Even non-prescription supplements can be risky. For example, St. John's wort can interact with antidepressants and blood pressure medications. Ginkgo biloba may thin your blood, increasing bleeding risk if you fall. What many people don't realize is that medications can affect multiple systems at once. Inner ear function, which controls balance, muscle tone and reaction time, blood pressure regulation, cognitive processing, for example, confusion, delayed response, visual clarity, especially with drugs that cause dry eyes or blurred vision. The AARP warns that falls related to medication are vastly underreported, often mistaken for clumsiness or aging. Yet the consequences can be devastating: hip fractures, brain injuries, even loss of independence. Here are the 4 key steps I recommend to every patient over 60. Create a full medication inventory. Include prescription drugs, over-the-counter meds, supplements, vitamins, herbal products. Update it every time something changes and bring it to every appointment. Schedule a medication review. Ask your doctor or pharmacist, do any of these cause dizziness, weakness, or balance issues? Can I take these together? Can I reduce or discontinue anything safely? Track your symptoms. If you've started a new medication and feel dizzy, foggy, wobbly, slower to respond, write it down. That's data your doctor can use to protect you. Make lifestyle adjustments. Get up slowly from bed or chairs. Use nightlights to reduce risk when disoriented. Drink plenty of water to prevent dehydration, a hidden cause of dizziness. Avoid alcohol, which magnifies medication effects in older adults. Mistake number 5, relying on furniture to get around instead of using a cane. If you find yourself grabbing chairs, countertops, or walls just to get across the room that's not managing, that's your body trying to tell you something important. Let me be direct with you. As a doctor who's cared for older adults for over 40 years, I've seen far too many people ignore the signs until it's too late. You're not weak for using a cane. You're smart for preventing a fall. The term furniture walking refers to the habit of using furniture, walls, or other household items for support instead of using a proper mobility aid like a cane or walker. It might seem harmless, even clever, until it becomes dangerous. According to the National Institute on Aging, NIA, furniture walking is a red flag behavior, often one of the earliest signs that someone is at risk of falling. It's usually a result of lower body weakness, impaired balance, or fear of falling. The Centers for Disease Control and Prevention, CDC, reports 1 in 4 Americans over age 65 falls each year. Falls are the leading cause of injury-related deaths among older adults in the U.S. After one fall, your chances of falling again double, especially if you don't address the underlying cause. Here's the kicker. According to a 2022 study in the Journal of Gerontology, seniors who use furniture for support are 3 times more likely to experience a serious fall than those who use proper mobility aids. That's a statistic you don't want to be part of. Why furniture isn't a safe solution? It moves, it wobbles, it's not designed to bear weight. You may think you're being resourceful, but here's what I've seen in my own patients. Bar stools tip over, low dressers slide on hardwood. Kitchen counters don't help when you're in the hallway. And worst of all, you're not building confidence. You're building dependency on unpredictable objects. Using a cane doesn't mean giving up. It means taking control of your safety, balance, and independence. A large-scale study from the Journal of Geriatric Physical Therapy found that seniors who use canes correctly can reduce their fall risk by 45–50%. Canes also improve gait symmetry and walking endurance. Participants reported higher confidence when walking indoors and outside. And it's not just physical, it's emotional. Confidence is protective. The more confident you feel walking, the less likely you are to hesitate, which is when most falls happen. If you've been furniture walking, it's time for a better strategy. Here's what I recommend. Get a professional fitting. Go to a medical supply store or talk to your physical therapist. The right cane should match your height, grip strength, and gait pattern. Use the cane consistently. Start inside your home practice walking short distances. Then progress to errands, walks, or church. It'll feel natural in no time. Improve your environment. Remove loose rugs. Add grab bars in bathrooms. Ensure good lighting, especially at night. Keep pathways clear. Train your strength. Use light leg exercises and balance drills, like sit-to-stands or heel-to-toe walks. Combining strength training with cane use helps you rely on it less over time, but more effectively when you do need it. Mistake number 6, which we can completely fix, not doing balance exercises. As we age, our muscles weaken, reflexes slow, and vision changes all of which directly impact balance. But here's the kicker. Balance isn't just physical, it's neurological. It's a complex system involving your brain, eyes, ears, joints, and muscles working together. According to the Centers for Disease Control and Prevention, CDC, more than 36 million older adults fall each year in the U.S. Falls are the leading cause of injury and injury-related death in Americans aged 65 and older. Roughly 75% of falls happen at home, and most are preventable with proper balance training and home adjustments. A report from the National Institutes of Health, NIH, states, after age 60, the body's balance systems decline rapidly without intentional movement. People who do regular balance exercises reduce fall-related injuries by at least 30-40%. That's a significant reduction, especially considering a hip fracture can lead to a one-year mortality rate of up to 30%, according to the Journal of the American Geriatric Society. The best part? Balance training doesn't require expensive equipment, long workouts, or even a gym. In fact, a study published in JAMA Internal Medicine found adults over 70 who performed just 10 minutes of balance-focused activity per day had 42% fewer falls within 3 months. Those who combined it with light strength training had better posture, stride control, and confidence walking outdoors. What counts as balance training? Simple, low-impact moves like standing on one foot while brushing your teeth, heel-to-toe walking down a hallway, lateral weight shifts while holding onto a chair, Tai Chi or modified yoga poses for seniors, marching in place with high knees. You don't need to break a sweat. You just need intentional, steady movement that challenges your body to stay upright and centered. Even 5 minutes a day can help your brain reconnect those pathways. You don't need to fall to know your balance needs attention. Here are common warning signs. You hold on to walls or furniture more than before. You feel unsteady walking in low light. You avoid stairs, curbs, or grassy areas. You pause before stepping just in case. You've noticed slower reaction time when shifting direction. These are subtle clues that your body is adjusting to instability, but it doesn't have to be that way. Mistake number 7, a common one that happens often, not drinking enough water. Dehydration doesn't always look like a cartoon character crawling through the desert. In older adults, it's quiet, slow, and often ignored. Here's what the Centers for Disease Control and Prevention, CDC, says. As we age, our sense of thirst declines, so we don't feel thirsty even when our bodies are low on fluids. Dehydration is one of the most common causes of hospital admission for adults over 65, often because of dizziness, confusion, or fainting. A 2020 study published in the American Journal of Clinical Nutrition found that nearly 40% of seniors in assisted living facilities were clinically dehydrated, and most had no idea. The National Institutes of Health, NIH, also reports that even mild dehydration, just 1-2% of body weight in water loss, can cause drop in blood pressure, reduced brain perfusion, blood flow to the brain, difficulty concentrating, slower reaction time, muscle cramps, orthostatic hypotension, that head rush when you stand up. This isn't just uncomfortable, it's dangerous. Especially for older adults, dehydration increases fall risk, raises chances of urinary tract infections, and can even worsen cognitive decline in people with early dementia. As we age, several changes make dehydration more likely. The kidneys become less efficient at conserving water. We have less muscle mass, which stores water. Many seniors take medications like diuretics, laxatives, or blood pressure pills that increase water loss. Our body sends weaker thirst signals, especially in cooler weather. The Mayo Clinic recommends that most adults over 60 should drink at least 6-8 cups, 48-64 ounces of plain water daily. And that doesn't include coffee, tea, soda, or alcohol, which can actually increase dehydration. Some studies suggest even mild dehydration can reduce mental clarity by 13-15%, decrease physical coordination by up to 25%, increase fall risk by nearly 30%, according to research from Harvard Health Publishing. Here's what I recommend to all of my patients, and most of them are over 65. Start your day with a glass of water before anything else, even coffee. Keep water in visible spots on your nightstand, next to your recliner, in the kitchen. Use a water tracking app or a marked water bottle with time goals. Flavor water naturally with lemon, cucumber, mint, or orange slices if taste is a barrier. Pair water with routines, drink a glass every time you take meds, eat a meal, or return from the bathroom. Don't wait for thirst set timers or reminders if needed. Bonus tip: soups, fruits, and vegetables with high water content, like watermelon, cucumber, or broth, can help meet your hydration needs too, especially for those who struggle with plain water. Mistake number 8: living in a home that's not senior friendly. According to the Centers for Disease Control and Prevention, CDC, over 3 million older Americans are treated in emergency rooms every year because of falls, and a large percentage of those happen inside their own homes. Let that sink in. Your home, the place where you feel safest, could be the very thing putting you at risk. A 2022 study published in JAMA Internal Medicine found that 79% of senior fall-related injuries occurred in commonly used areas, like bedrooms, especially getting out of bed, hallways due to poor lighting or clutter, bathrooms, slippery floors, no grab bars. And most of those homes didn't seem dangerous, just unprepared. A few years ago, my patient George, 76, came in with a bruised hip. He was healthy, walked daily, didn't use a cane. But that week, he got up at night to use the bathroom, tripped over a power cord, and landed on the tile floor. His exact words were, "Doc, I've lived in that house for 30 years and never once thought the hallway could take me out." If you're living in or visiting a home with loose rugs or curled up corners, power cords stretched across walkways, dim lighting, especially at night, slippery bathroom floors, no grab bars in tubs or near toilets, items stored too high or too low, stairs without handrails, then you're living in an environment that increases your fall risk, whether you feel stable or not. Remember, it's not about how strong you are, it's about how safe your surroundings are. The good news? You don't need a full home renovation. Small changes can cut fall risk by up to 50%, according to the National Institute on Aging, NIA. Here's what I recommend to every patient over 60. And yes, I follow these in my own home too. Install nightlights in bedrooms, hallways, and bathrooms. Use non-slip mats in the shower and on bathroom floors. Add grab bars near toilets and inside showers. Secure or remove throw rugs, especially at the foot of beds. Coil or tape down cords near walkways. Store frequently used items at waist or chest height. Use a sturdy shower chair if balance is a concern. Make sure stairways have handrails on both sides if possible. These changes don't make your home look like a hospital. They make it a place you can grow older with confidence. Now that you've heard all 8 mistakes, from the wrong shoes, to skipping strength training, to ignoring your home's hidden hazards, I want you to remember this. Balance is not just physical, it's your confidence, your independence, and your freedom. And the truth is, most of what steals it away is preventable. So take a look around your life. Are you giving your body the tools it needs to stay steady? Are you giving yourself the safety you deserve? Don't wait for a fall to wake you up. Take one small step today. You are not too old. It is not too late. And hey, if this video helped you or someone you love, share it, pass it on. And don't forget to like this video and subscribe to Elderly Health Tips, because growing older should never mean growing weaker.